Hello AP students, this is Mrs. Politsky and I have notes for Chapter 13. We're going to talk about hospitalization and alternatives. Mental hospitals were originally conceived as a place of refuge for patients, basically asylums, where disturbed people could escape the pressures of normal living. In fact, they often worked well. By the 20th century, these hospitals had unfortunately become overcrowded and at best a little more than warehouses for the disturbed with nowhere else to go. Rarely people of means were committed to mental hospitals. Instead, they were given private care, including psychotherapy. By contrast, the large public mental hospitals basically were used to form a group therapy. That was done, but unfortunately with the whole ward, perhaps maybe 50 patients at a time. So, the therapeutic community. Therapeutic community, this is a term that was coined by this man, Maxwell Jones. It's a term for a program for treating mental disorders by making the institution environment supportive and humane for patients. Maxwell Jones proposed replacing traditional hospital treatments for mental disorders with a therapeutic community designed to bring meaning to the patient's lives. He envisioned the daily hospital routine itself being structured as a therapy that would help patients learn to cope with the outside world. He abolished the dormitory accommodations that had been typically part of the mental hospital systems and gave patients more private living quarters. He also required that they would make decisions about the meals and daily activities. Patients assumed tasks of everyday living, including laundry, housekeeping, and maintenance. Jones involved them in helping to plan their own treatment, which included not only group psychotherapy but occupational and recreation therapy as well. Newer approaches obviously required more staff and more costly facilities. High cost led to a search still for another alternative, which came in the form of community-based treatment. This was began because it was more and more attractive because of the increasing availability of drug therapies. Deinstitutionalization and community mental health. Deinstitutionalization is a policy of removing patients whenever possible from mental hospitals and returning them to communities for treatment in a more familiar and supportive environment. This concept is popular with politicians who saw the large sums of money being poured into these mental hospitals. Today we see a lot more of community mental health movement, and this is an effort to deinstitutionalize mental patients and provide therapy from outpatient clinics. Proponents of this community mental health envision that the recovering patient could live with their families in a foster home or a group home. The major focus of treatment should shift from the mental hospitals back to the community. Both psychological and drug therapies would be dispensed from an outpatient clinic, and recovering patients could live with their families in a foster home or in a group home. Community mental health clinics, these are the centerpieces of the community health movement. They rarely receive full funding by our government. Chronic patients were released from mental hospitals, but they often returned to the communities that could not offer them but just a few therapeutic resources, and to families who were ill-equipped to cope with them. As patients returned to the community, they needed care, and they entered psychiatric wards at the general hospitals rather than mental hospitals. And as a result, hospital care has continued to consume most funding for mental health in the United States. Currently, mental health patients account for 25% of all hospitals. An estimated 150,000 persons, especially those with chronic schizophrenia, have ended up homeless with no network of support. Although estimates vary widely, but up to 52% of homeless men and 71% of homeless women in the United States probably suffer from psychological disorders, and many of them are former mental hospital patients. Many also have problems with drugs and alcohol. Under these conditions, they survive by shuttling from agency to agency with no one to monitor their behavior. They usually stop taking their medication, and so their condition deteriorates until they required a period of rehospitalization. Psychology in your life. What sort of therapy would you recommend? Well, lend a friendly ear using techniques of active listening, acceptance, and exploration of alternatives. A therapy checklist. These are questions that you would want to consider before recommending a particular type of therapist. Is the medical treatment needed? Encourage a friend to see a psychiatrist for medical treatment if you suspect that the problems involve psychosis, mania, or bipolar disorder. If there is a specific behavioral problem, behavioral therapy or cognitive behavioral therapy with a counseling or clinical psychologist is probably the best bet. Non-psychosis, of course. Would group therapy be helpful? Group therapy is valuable for help and support, where a person can learn not only from the therapist but also others from the group. Effective in dealing with shyness or a lack of assertiveness and addictions and with complex problems of interpersonal relationship. Is the problem one of stress, confusion, or choice? Some cautions. Drug therapies to avoid. The minor tranquilizers are too frequently prescribed for patients, leading to chronically stressful lives. Advice for the interpretations to avoid. Patients should also be cautioned that some therapists may give ill-advised counsel in problems of anger management. Thank you very much.